Parker, how are you?
And how are you?
I'm great, thank you.
The SMILE program is an innovative program that was designed through the Regional Delirium and Functional Decline project. We really look at engaging volunteers and patients and families in their care and ensuring that they become more active and alert in terms of activities that they're involved in.
Hi Margaret, my name's Jason, I'm from the SMILE program. You ready to have some fun? Yeah. Ready to play some activities? Yeah. All right.
You saw her face, the big smile. You could tell she was excited, and I was hearing her say words I've never heard her say before. Like just cute little words when she was trying to put the blocks in. I think it's fantastic.
Oh, when you mean my mouth.
Well, SMILE is actually an acronym. It's easy to remember and it's a friendly little phrase, we think. So S stands for stimulate the mind, N stands for move the body, I stands for improve hydration, L is for limit caffeine and sleep enhancing medication, and E is enjoy better hearing and vision. If a person has their eyeglasses, if they need them to be on, or the hearing aids, they're likely to engage in activities and they're not going to experience what we call sensory deprivation. It's very important to have these pieces of adaptive equipment on to function.
I'm able to help get them to smile. With every single patient, we get to do something different.
I think the SMILE program is excellent for a number of reasons. The overriding principle is certainly to prevent delirium, which is unfortunately an all too common occurrence, especially as the population that we treat gets older and older coming into hospital, and certainly does have a negative outcome both in the immediate term as well as on their future recovery.
It's changing the lives of the patients because they do have the focus on them, and they're preventing the confusion and delirium from setting and keeping them centered, keeping them focused.
Kaitlin, you're going to have two really interesting people to work with today.
I find it extremely rewarding to come in every week, and there's a huge impact that you see. If they struggle with one thing, they get better at it, and you can see the self-confidence come through.
It's an opportunity to perhaps enjoy a game.
Or using the puzzles, help keep their hands active and their minds active. So by keeping those activities handy, then that's something that we can give them to sort of keep their brain active on another task.
Along with keeping them occupied and stimulated in positive ways, another benefit of the SMILE program is
companionship. It's very, very lonely for some.
Studies show that patients spend up to 90% of their time completely alone in their rooms with very, very little stimulation. So a senior in particular is very vulnerable to getting more ill in that type of situation, of developing delirium, which is actually a medical emergency and could be potentially fatal, or declining functionally, which basically means they can't return home with the same type of activity level that they had.
I think the SMILE program on a number of levels with regards to increased patient interaction, helping to orient the patients properly, helping to promote their oral hydration, and especially involving the family members in the care process, because sometimes in the past there was a little bit of a disconnect there, so this helps to bring the families into the treatment program as well too.
You know what, I think it's fantastic, somebody to just spend that one-on-one time.
Because of programs like SMILE, Halton Healthcare Services recently received a very prestigious award.
We are so proud. This is the second year in a row we've received exemplary status with NICH, and NICH is Nurses Improving Care for Health System Elders. It's an international organization of 575 member hospitals, and we were one of 46 to receive the exemplary status this year, the second year in a row, and last year we were the first Canadian hospital to receive this award.
Anyone that really wants to have a huge impact on someone's life, this would be a perfect program to volunteer with.
Very, very nice people. Just a good feeling that these people are available.
Every time I come in, they always smile and they always remember me.
It's extremely rewarding.
It's so good. You know, my mother hasn't had that much fun in years. I think it's fantastic.
It was exciting?
For more information, go to haltonhealthcare.com.